And you mentioned the behavioral RX science-based approach. You want to talk about that a little bit more in detail about how what the process is to actually engage those using GoMo Health Services.
Sure, sure. So we really believe, and I'm sure you all would agree, no two people are alike. Everybody has different things going on in their lives, different stressors and responsibilities and things like that. And we're talking about women's health, even as a mom myself of three kids, three different profiles, three different needs, interests, things like that. So our whole system is based on that principle that no two people are alike. So to treat and communicate and engage with every single person in exactly the same way would be silly because everybody's going to respond to something different. They're going to engage, they're going to latch onto something different. And once they latch on and they believe that the resource of information is credible and that they can trust it, they're going to engage further and they're going to come to it and they're going to look at what's sent to them from that resource and answer the questions that they're being asked. So the whole science, this whole science of precision engagement is structured in a way that we can collect information from the people that we're talking to in order to customize their experience. And then the experience that we deliver is customized for them. So we ask questions, we get information. Our system is entirely bidirectional. So the way that we would talk to you, Mitch, about your mental health issues, for example, would be different than the way we talk to Rebecca because you both have different things going on beyond your mental health issues. You're not just about your mental health issues. You have family factors, professional factors, psychosocial factors, relationship factors. So all those things are considered on an individual level. And our science has 8 different principles that we leverage to collect that information, build the experience, deliver the experience, and refine it. So for example, we're all about being simple and highly directed. We don't want to talk to people and give them a whole, overwhelm them with the information that we're providing. So we deliver, for example, one thought at a time, one individual idea that somebody can act on. So they can focus, they can direct themselves to that ask, they can respond to it. And when they do, they say to themselves, hey, I can do this. I can be active in my own health. I can manage it. I can do it. I'm building my own confidence. I remember a couple years ago, my mom was going through breast cancer and treatment, and she was dealing with a hospital in New York City and she's from a small town in Pennsylvania. So already you got the anxiety building and the worry, not just with the disease and the diagnosis, but the travel and the logistics and how am I going to handle it? And she got this packet of information from a world-known cancer treatment center in Manhattan, and I came home to help her. The entire kitchen table was covered with paperwork, registration, testing, admissions, the hospital where she was going to be treated, the hotel that they were affiliated with, and how to get there. And she's looking at this table information. And she looked at me, she said, Shelley, how am I going to handle this? How am I going to navigate this? We are that navigator. We take all of that information and simplify it. So you see, talking about my mom, all the factors, the human factors. If that patient was in Manhattan, they wouldn't be worried about travel. They wouldn't be worried about hotel. They wouldn't have that stress and anxiety. So my mom's that, the other individual who has those factors. The Manhattan patient has the other factors. So our science enables us to learn about both of those two people, for example, and build a pathway to engagement and activation that's customized specifically for them.